like he just came from the hospital, but he is passed out on the ground right at the light, the stoplight, and he's not responding.
At 68 years old, New Orleans native Jerry has weathered the worst storms, from Hurricane Katrina to cancer. But this one,
I don't know if he's okay.
it feels just as traumatic for his loved ones.
I just couldn't believe it, that they, number one, would do it in such a inhumane way, and number two, that they didn't call anybody.
October 14th, surveillance CBS 46 Investigates obtained shows Jerry being wheeled out of his Piedmont Rockdale Hospital room at 10:17 a.m. Two medical staff with a security guard continued to wheel him outside to the edge of Piedmont's property, where by 10:39 a.m., 22 minutes after first being taken from his room,
as I arrived,
Conyers Deputy Chief of Police Scott Freeman found the unconscious man with medical tubes sticking out of his body.
oh my God, this cannot be happening. Fire rescue personnel as well as EMS personnel, their initial response was he needs to be in the emergency room.
In fact, the Department of Health and Human Services documents we uncovered show earlier that day, a nurse at Piedmont Rockdale told a director that Jerry was too weak and that she can't believe he was being discharged. So if he needed emergency care, why was he taken from it? According to his roommate and beloved family friend,
This Medicare and Medicaid coverage ran out. I think they can only hold him for 30 days. So on day 30, out the door he went.
CBS 46 Investigates discovered earlier that same day, a hospital security guard called a Conyers officer on his cell phone saying, quote, Jerry had been in the hospital approximately 35 days, claiming he was homeless and just staying to have a place to stay, adding he'd been cleared as fit by two physicians and the hospital wanted him gone.
I should not have to sit and tell a room full of doctors and nurses you don't discharge a patient that is having a medical issue that needs to be hospitalized. Why does the police need to do that?
We uncovered the Department of Health and Human Services investigated Piedmont Rockdale 4 times related to discharges between 2007 through 2017. But the deputy chief alleges the pattern does not end there.
If you had to quantify, how many would you say?
It's hard to quantify. We usually have 2 or 3 a week that they allow to walk out.
The primary tenet of discharge is they have to be discharged to a safe environment.
Claire Thevenot is not affiliated with this case, but as a local patient advocate and former nurse, she uses her medical expertise to educate families on their rights and the rules which hospitals are required to follow.
In a lot of ways, they think they're doing the patient a service too. Oh, we don't want to keep them here at the expense of a big hospital bill if their insurance isn't going to reimburse them.
Regardless of the intent or insurance issues, hospital must follow discharge policies to remain in federal compliance, including verifying the patient is clinically well, confirming they understand their medications, treatments, and available resources, plus contacting caregivers or family for their departure. Policies which HHS just found the facility did not do. Days after we began requesting records on January 27th, HHS identified Piedmont Rockdale as a hospital in immediate jeopardy, citing it failed to ensure their discharge planning was enforced and followed. Family confirms Jerry is now in a long-term care facility.
He always worked his way through everything, but sometimes it just gets to a point where, gosh, what else is going to happen to me? And I think that's the point he was reaching.